had 367,395 cases. 2,883 new cases have been reported since yesterday. A record high, 2,033 people in the hospital, and sadly, 5,284 people who've died. Our prayers are with those who've lost loved ones to this cruel virus. We're seeing cases and hospitalizations rise steadily, as are many states across the country. We're continuing to monitor the data and the trends closely. We need to keep doing what we know works, wearing a mask anytime we're with people from another household, and social distancing anytime we leave our homes. As concerning as the numbers are, I and many other North Carolinians have newfound hope in the development of promising vaccines. Moderna and Pfizer both have produced vaccines with remarkable early results, better than health experts ever hoped for. What we know so far is this: safe, effective vaccines should be available soon. Our job is to be ready to get them to people as quickly and effectively as possible. North Carolina is working hard to hit the ground running when these vaccines are approved and shipped. For months, our Department of Health and Human Services has been developing a plan to distribute the vaccines so that we can get past this pandemic. But there's still a lot of work to do to get the vaccines from the manufacturers to our healthcare providers like hospitals and health departments, and then ultimately to each of us. Our state is preparing to receive the Pfizer vaccine that requires ultra-cold storage. Healthcare providers with these capabilities have been identified across North Carolina. We're a big state, though, with rural areas that stretch for hundreds of miles. Every person is important, and we'll work hard to overcome the challenges that our geography presents. The COVID-19 vaccine will be free, regardless of whether someone has health insurance. Healthcare providers are being enrolled in the vaccination program based on their ability to reach priority populations, those who are at risk of exposure, like healthcare workers, and those who are at risk of severe illness. Trusted providers like hospitals and local health departments will be among the first to vaccinate people. These vaccines have made progress so quickly because of significant improvements in science and technology, all while following safety protocols. Researchers, like we have right here in North Carolina, have been working on new vaccine technology for several years in preparation for a global pandemic just like this. And when it comes to determining safety, before the FDA will authorize these vaccines, an independent advisory board will review the data for safety. This advisory board has no loyalty to any company, political administration, or individual. The board exists to review the vaccine trials independently. I have confidence in this process. Healthcare workers, people in long-term care, and those at risk for severe illness will come first. But when it's my turn to get this vaccine, I'll be ready to roll up my sleeve. At this time, I'm going to ask Dr. Mandy Cohen, our Secretary of Health and Human Services, to share more with us. Dr. Cohen.
Thank you, Governor. As you mentioned, our trends are worrisome. People are going to the emergency department more and seeing COVID-like illness. Our cases are at their highest level since the start of the pandemic, and the percent of tests that are positive is up. Too many people are becoming seriously ill with COVID. Our hospitalizations have hit record levels with over 2,000 people hospitalized right now across the state. Sadly, more than 5,000 North Carolinians have lost their lives from this virus since our first death in March 12th of this year. To give some perspective, just under 1,500 people died from the flu in the past 10 years. In just 11 months, COVID had killed more than 3 times that number. These are more than trends and numbers. They're real people. With significant community spread across the state, anyone of any age can transmit COVID to someone who is at higher risk for serious illness. That's why our prevention tools, those 3 W's, are so important. Wearing a mask, waiting 6 feet apart, and washing hands often are proven to help prevent people from getting sick, keep people out of the hospital, and save lives. Fortunately, we are likely just a few weeks away from having a new tool that we've all been waiting for, a vaccine. COVID-19 vaccines will help us defeat this virus and get back to the people and places we love. Vaccines imitate an infection, so their bodies think a germ like a virus is attacking, and we make antibodies that we need to fight the real germs if they come and attack. The Food and Drug Administration and their External Advisory Committee will review 2 vaccines this month. Between those 2 vaccines, more than 70,000 people have participated in clinical trials to see if these vaccines are safe and if they can effectively prevent someone from getting COVID-19. The preliminary data looks very strong, and we look forward to reviewing the complete data when it's made publicly available in the next few days. Once a vaccine is authorized for use by the FDA, states will receive a very limited supply at first. To determine who should get the vaccine first, the North Carolina Institute of Medicine convened an independent COVID Vaccine Advisory Committee. Our prioritization plan is based on their guidance, along with guidance from the National Academy of Medicine on equitable distribution of vaccines. Initially, this very limited supply of vaccines will go to a limited number of hospital settings to vaccinate healthcare workers at high risk of exposure to COVID-19, those who are caring for or cleaning areas used by patients with COVID-19. As more vaccine becomes available, we'll be able to have vaccine distributed to more of the state's hospitals and then to our local health departments to focus on vaccinating our high-risk healthcare workers. Additionally, long-term care staff and residents are prioritized to receive vaccines. Vaccinations at our nursing homes, adult care homes, and other long-term care settings are being managed by the federal government. However, the vaccines used in those long-term care settings will come from our state's vaccine allotment. We hope that by January, our health departments and community health centers will start vaccinating other high-risk adults who are at high risk for complications, meaning they have 2 or more chronic conditions and are at higher risk for exposure. The key takeaways are that vaccines will initially be available in limited settings, primarily focused on our hospitals across the state and then our long-term care residents and staff. As the governor said, the vaccine will be free to everyone, and any fees associated with administering that vaccine will be paid by either your insurance company or by the government. We've been hard at work preparing for this moment. Our vaccine plan outlines the critical steps needed to administer a vaccine program of this scale. Anything from enrolling providers to give those vaccines, to ensuring that the vaccines are distributed equitably and providers can properly store and handle them, to developing an IT system to manage vaccine supplies and ensure that people get both doses of that vaccine, training providers on how to use those IT systems, to have that process to monitor for any adverse reactions, and so much more. States are going to need ongoing federal support and federal dollars as we undertake such an unprecedented effort. Having a safe vaccine within reach is an extraordinary achievement, but at the same time, it is not a quick fix. It will take several months to have enough supplies so that anyone can readily get a vaccine. Until most people are vaccinated, those 3 W's remain our best tool to protect our loved ones, to make sure our hospitals are there for those who need them, and to save lives. So, whatever your reason, get behind the mask. Thank you, Governor.
Thank you, Dr. Cohen. Appreciate your hard work and the work of your staff. As the states are shouldering the job of vaccine distribution, we need more support and resources from Washington. I know Congress is facing a deadline this month to keep the government running. I implore them to do more to support families and small businesses, as well as the states, which must create networks for vaccine distribution. Within the next few weeks, there will likely be at least one approved vaccine. And with hope so close on the horizon, we have to keep using the tools we know slow the spread of this virus to help save lives during the next few months. Don't give up now when help is on the way. Wear a mask. If there's ever a question about when we should put on a mask, err on the side of wearing it. It's an easy way to protect our family and our neighbors, and it actually helps boost the economy. When we all wear our masks, we help keep businesses open and customers and employees safe. Practice social distancing. Anytime we leave the house, anytime we are near people we don't live with. These simple measures do save lives. I also appreciate the continued efforts of local governments like the City of Asheville, Buncombe County, City of Winston-Salem, that are increasing enforcement of our existing strong orders. This enforcement, along with more local governments getting on board, can bring our numbers down and keep us from having to go backward. Again, don't give up now. We need to work together and stay vigilant. If we do, I know we'll get through this.